We recently had Bob Anthony from the Naples Florida Chapter speak about the program promoted by Rotary, which was developed by the mental health professionals at Boston Children's Hospital to improve mental health for children. And Bob is a member of the Rotary Action Group on mental health. Now, the goal of this program is to treat symptoms of children's mental health early so they can live a long and healthy life. How to achieve this goal? Enable the pediatric primary care practitioner to manage all moderate cases in collaboration with the behavioral health specialist when available. The program includes 3 core components: self-paced web-based training on the most common mental health conditions of youth, such as anxiety, depression, and ADHD, ongoing consultation support for medical teams, and guided self-management toolkits for the patient and parent. And the training for prescribers and patient self-management tools overcome implementation barriers such as clinician time constraints, productivity expectations, and it improves revenue through additional billing codes and billing strategies that enhance care. In primary care, pediatricians can stay involved after they refer patients to specialists. Counselors, schools, and families can download the guided self-management toolkits for families so all professionals are on the same page. And if you're in the Rotary, please join the Mental Health Initiatives Action Group. And he also gave us some outlines that he uses for his professional presentations. And I'm not going to read all the fine points on these. It improves health equity, reduces burnout, and it not only increases the revenue for the practice, but also improves the care for the patient. And it alleviates a lot of the frustration that some of the staff of the pediatricians and mental health professionals have when they're dealing with mental health for children. And it lowers the stigma of seeking mental health care, as well as improving the quality of life for the child and for the family. Early intervention is essential, and this provides more efficient and equitable delivery of mental health care to children in settings where access to mental health care can be limited. And it improves the outcomes for mental health concerns, and improves satisfaction at work and decreases burnout. And this encourages partnerships between schools, foster care, juvenile justice, and community organizations with the pediatricians and the children under care.
Bob is the Executive Director of Adolescent Wellness, Inc., a 501c3 nonprofit he founded in 2005 after a 20-year career in the tech sector. AWI promotes wider implementation of resources to provide early treatment and prevention of mood disorder. Bob is a member of the Rotary Club of Naples. He is the 2022-2025 chair of the Rotary Action Group on Mental Health Initiatives. He has an MBA from DeVry University, Keller Graduate School of Management, and his CPA is from the University of Illinois.
So you heard I'm chairing until July 1st the Rotary Action Group on Mental Health Initiatives. Our membership is now over 500 people around the world. We have things called district chapters of the Rotary Action Group on Mental Health Initiatives. We'd love your district to think about becoming a chapter. That gives you a page within the global website to make your news a little wider spread, call for volunteers a little easier. One of the purposes of the action group is to find what's working and make it well known to other districts, other countries even. This presentation is one of a dozen toolkits that we have found to be very effective for Rotary members to introduce to a community. The title is Ending the Wait List for a Child Psychiatrist. It's more than that. It's really early intervention. This talks a bit more about the mental health initiatives, Rotary Action Group. We've got 35 of these district chapters. The overall mission of the Action Group is to break stigma, raise awareness, and to increase capacity. We've doubled the number of pediatricians who actually treat mild and moderate cases of ADHD, anxiety, depression. A variety of toolkits. One's as simple as PIP, creative problem solving. So by going to the ragonmentalhealth.org, you can see these toolkits. I had experience with the toolkit coming out of Boston Children's Hospital. It's 7 years ago. We helped them develop this program, and it's kind of a payback when they did the pilots. They did Los Angeles Children's Hospital, Connecticut Children's Hospital, obviously Boston Children's Hospital, and Naples Community Hospital. So we were able to actually prove that it also works in the rural area. What this is addressing is that nationally, not just in Florida, but nationally, there's a 10-year lag between first symptom, first treatment. The vast majority of mild and moderate.
One of the most challenging things about being a parent is just finding the balance. I have 5 daughters. They're all different. What might work for one might not work for the other. It's just hard. My kids have a big trauma in their life. My child's father passed away. When she was little, a teacher told us, she doesn't look at us in the eyes. She wouldn't sit still. In kindergarten, she couldn't pay attention. So we did see some things in Gianna, just like we saw in Micaela, but a lot more came out once their dad passed away. It just became even more difficult.
I had a really hard time with math. The way they explained things to me was really confusing, and I just couldn't understand anything. Reading was a struggle, and I couldn't read any of the packets or anything of the instructions. So it was really hard to read and write.
My anxiety was really bad, and I had panic attacks multiple times a day, every single day. That was probably the hardest point in my life. I just felt like everything was crumbling in on me.
It's hard. It's very hard. I felt like I was drowning, but even worse, she felt like she was drowning. And I didn't know how to get her out of there. So I came to my doctor's office to ask for help. I met with Dr. Anzalone and Dr. Tam, and then I was introduced to the toolkit.
One of the things that we focus on in our clinic is teaching basic coping skills, and one of the very helpful resources has been using the toolkits from Boston Children's Hospital. They teach small, evidence-based ways to reduce anxiety, reduce depression, and manage behavior in general. And through teaching those skills, one, you can help individuals with all levels of severity, and it also keeps people from having unnecessary treatment, time, and costs.
To have it organized in a way that you can actually focus on each child's issue and have an ability to be able to manage each child personally and in a way that it's going to be meaningful for that child's issue is going to help her, because it can be overwhelming. But when we can give people the ability to organize it in a way that makes their lives easier and bless their children in a way that they can heal, empowers her.
When I read it, it just all clicked. It's kind of like, wow, I'm not the only one that's going through this. I'm not crazy. My kids aren't crazy. There's people that understand and other people that are going through the same things that I'm going through. So it helped me.
It's amazing, honestly, what these toolkits can do. If you just read some of the information, it makes a lot of sense. It felt great. It made me feel better. I'm definitely doing a lot better these days than I was before. It was great.
Today, the girls are doing good. They're much better. Every day we're still working on stuff, but much, much better. The girls have improved a lot. If you're a parent wrestling with this, I've been in your shoes. Read it, give it a try, and it works.
The toolkits are actually free downloads from the buildingbridgesofunderstanding.org. This is the toolkit they're talking about. So they hand that to a child who screens positive just on a well child visit. And the breakthrough about this is pediatricians are really smart, but they graduate before doing the residency in psychiatry and 2 years before doing the residency in child psychiatry. They screen, they diagnose, and they refer out. And part of the reason is A, the training they didn't have when they were still in med school, and B, they have 7 minutes. So you may be at the doctor's office for a lot longer, but if you think about the time you're actually with the nurse practitioner, physician assistant, family doctor, or pediatrician, 5 to 20 minutes, right? How is this achieved? There's not enough child psychiatrists. Not clear whether medication is part of the solution or not. So who else can treat as well as diagnose, including medication? And that's not behavioral specialists. It's those pediatric primary care practitioners. So this is evidence-based. These are all white papers online on that same website. So it's well documented. The breakthrough here is that Rotary members are introducing it to doctors saying, A, you can have both the competence and the confidence to do this with every patient, and B, there's a way to do it in the time that is available. So the innovation was to change the workflow. It's practical because even with a positive screen, instead of talking with the mom or dad for 20 minutes, the child gets the relevant toolkit handed to them for ADHD or whatever the ailment may be. And then separately, the staff has a separate one for the parent on the same topic, including a follow-up appointment when they actually have a little more time to do a focused assessment. It's not a referral, it's not a list of phone numbers. Treatment started during that well-child visit, and 3 weeks later they have a little more time to talk about it. And the child's had some time to practice the exercises, understand what maybe the school's talking about, certainly what the doctor's talking about, and to see whether that's enough. It's sustainable because the billing codes for the pediatricians who are doing this, I don't know if you're happy to hear this, the total billing for a community health center moves from $238 to $600. A second reason it's sustainable is because they typically cannot do over the phone tonsillitis assessment, but they can do over the phone behavioral health, even though they're a licensed prescriber. And so they can actually bill for telehealth. There's supports for this as well. It's in place. Few doctors know about it. The Rotary Club of Naples introduced a fully funded phone support system with a child psychiatrist taking care of pediatricians. The pediatricians in Collier County were not aware it existed. Rotary did this. Numbers in our county doubled their knowledge of the ailments in the tests that they take for the self-paced training, and they doubled their confidence. And all of the graduates said that they wanted to actually begin taking care of behavioral health in their practice. These are standardized surveys of clinical global impression improvement scale. Kids came in 72% better than they went in. And parents, 86%, felt confident their doctor was doing the right thing for their family. It's actually a national program. It's actually in Virgin Islands, all the U.S. possessions. The way that you help is by networking. The second piece we do is offer the chief medical officer scholarships for all of their pediatric primary care practitioners. They have to get continuing medical education anyway. We'd love you to join the action group as well. What we're doing is affecting you in this county is presenting at the Florida Association of Community Health Centers. They're giving Rotary a table, an educational table at this conference in Orlando in July. They're having 2 breakout sessions on this topic. And the reason we want to pursue it is one doctor takes care of 1,000 kids, and perhaps 15-20% of those kids have symptoms. So you're reaching 200 kids if you take care of one doctor. The thick book on the table goes to the family. That's 10 different toolkits in their book. Thin book that's on that table is actually for the doctor. It's kind of a cliff notes of the video course that they complete. That's a 5 CME course. And if you think about it as basically flowcharts, decision trees, here's a decision tree, ADHD for a 6-year-old, a dozen exercises, ranging from getting organized to problem solving. That may be all they need. We all can have better organization skills. I certainly wish I had that knowledge when I was younger. So this just talks about whether that's enough. And if it's not enough, it goes into the medication. And then there's a separate decision tree for the type of medication, the age. If the physician is convinced medication would be helpful, but there's epilepsy or there's 100 other ailments, they call that hotline to verify contraindications or get some guidance. Same toolkits in English and Spanish as free downloads from the website. Rotary is converting it to Haitian Creole because in Collier County, that's the 3rd most common language. Oftentimes the kids speak English or read English, but oftentimes the parent does not. So these are going to be YouTube recordings. In the local pediatrician's office, we're pre-printing those and putting them in two-bin system.
You make it very easy for the providers to offer and introduce this to their patients.
Exactly right. So this resource is free and it's readily available to any school. It's unusual for a school to get through to a doctor's office. So the parents can download this, teacher can download it and give it to a parent. Yes, yeah. So everything's free except the doctor's training. This is that billing stream. The point is, down here it gets to $257 for the first follow-up visit. And the pediatrician stays involved, even with that follow-up focused assessment. That's the incentive for the doctor to stay involved. That's the CAN presentation. In my experience, the school speaks one language about symptoms and treatments. Psychologists speak a second language. The psychiatrists speak a third language.
Yeah.
And even though you're in the room and you're all passionate about finding a fix for your kid, you don't have a clue what they're talking about. And you don't know who to call when you get back home. They have a treatment team. Well, I didn't know that. Who's doing what. So one beautiful thing about having even the school or any trusted adult is everybody can literally be on the same page. Were you able to get through this type of activity in the toolkit?
Couple of quick questions. Who wrote all of this material?
Yeah, so in the front of both of those books is a listing of all the professionals involved. Boston Children's Hospital, psychiatrist in chief, David DeMasso, is a key person. The person who runs that telephone support in Massachusetts, Dr. Heather Walter, is a second person.
I go talk to my doctor. He
Yeah.
says, well, you're not a doctor. You don't know what you're talking about. You're just a layman. Why should I listen to you? Okay, what's my counter?
Well, so are you talking about as a patient or as a Rotary member?
As a Rotary guy.
Oh, just tell them to make some money and they'll be able to take care of early symptoms.
You're saying this is a way to show you how to more efficiently run your practice and how to increase your billing. Is that what you're saying?
That's correct.
Basically, yeah.
Yes.
So, I mentioned Pediatric Associates during our call. My daughter-in-law is a nurse practitioner at one of their facilities and talked to her a little bit about this and, another one. And when she heard billing codes, her eyes opened up, okay? Because that's what it's all about. And as you know, I believe Pediatric Associates runs the best business model for pediatrics in the state. I don't know how far up they go. I think they go in the southeast. So I was waiting for this meeting, and we'll talk later if I can get one of these manuals for her to show her. She needed to present something to whatever the chief is in that office. And once one office adopts it, it pretty much goes throughout. Again, once they hear the billing code.
Are you available for a Zoom call, like if we have a contact with a really big hospital?
Yes.
In the toolkit, I see there's some questionnaires in there for that. Do they download those first instead of getting the whole toolkit? So, and then there's 10 pieces and 10 chapters in here, I would say, right?
You're talking about the doc now. They take the course, and in the course they talk about the standard instruments. Every office does different things. A common one is called a pediatric symptom checklist, a PSC. And literally in 20 questions, the parent answers and the kid answers. Based on the number at the bottom of the 3 columns, they're good to go or they have early symptoms of anxiety.
Okay.
And that's what triggers the toolkit being handed to them and the staff setting up a follow-up appointment.
So with the whole toolkit gets handed to them, the big thick book.
Just that one exercise by age. And then there's a more focused assessment that goes into more depth in the follow-up meeting.
And the handoff from the pediatrician is the phone support. Is that correct?
No, they're supposed to stay with the patient.
They still stay with the patient. Yeah.
So
because it's their patient. That's where the patient they see a couple times a year, especially calls and things. Well,
exactly.
Okay.
And what the docs will say is, we wanted to do this. We care about the kiddos. We don't have time.
Yeah.
Or we don't have training, or both. This makes it practical to do in the time available, and it also pays them for the time they're putting into it.
Do they eventually get transferred to a psychiatrist?
The pediatric associates or whatever the practices will have a protocol in place. Ideally, there is a behavioral health specialist involved at that same first day, and certainly involved in that 3-week follow-up. But the difference is that the pediatrician is also involved. They haven't just said, okay, you're on a different track. They're both working it. They are the treatment team.
Right. So if the pediatrician thinks, oh, this is too much for me, I'm going to transfer it over to someone else. Or
That's the way they used to do it. We're trying to change that.
Oh.
So the talk therapist, if you will, is still involved, but the pediatrician's still involved,
Okay.
and that's the change.
Oh, I see.
So that's the workflow shift we're trying to implement, and that's why a medical director would.
The doctor becomes certified in this? Is that what it
Yeah, they're already certified, but they're not comfortable.
does it go like towards their continuing education? An actual viable accredited?
Yes, Category 1 American Medical Association credits. It's the highest
Oh,
tier
okay. So it
accreditation.
should be on some.
Yeah,
on
it's
some
from
manual
Boston
somewhere,
Children's
some-
Hospital.
Okay.
Yeah, so
so
it's a 5 CME program.
Okay.
And on that, so is there a cost to the practitioner
Yeah.
for that?
So in the medical field, you cannot give away continuing medical education.
Okay.
To overcome that, we give scholarships. We buy it, from Boston Children's Hospital, but to the practitioner,
And just follow up, what is that scholarship?
$250
That's
for the 5
so-
CME course.
For the 5.
So it's
Yeah,
50,
and everything else is free.
so it's $50 a credit hour, basically.
Everything else is digital.
But you're saying it's free to the doctor because you're paying for it.
Yes, sir.
Right.
And that's for every physician in that location needs to have that.
So the ones who can prescribe,
Maybe back to my daughter-in-law as a nurse practitioner,
they go.
a couple of them get certified in there, so they're the prescribers in that office that do that.
And
Scholarship
the list,
of
and the list
$250.
is nurse practitioner, physician assistant,
So
family
for the doctor all the way up to
pediatrician.
category 1.
I love
Okay.
the story of the family. I mean,
Yeah.
it really puts
Yeah,
it
that's
into
good.
perspective
Yeah.
when you see it that way.
And that's real. That's Jennifer Montoya. Yeah, she's terrific. She is a realtor. And she actually introduces the video. Yeah, her kids are.
If you are in Sunrise, Florida, please visit our club. You can find the meeting times on our club website. I have a video on the history of Rotary and my personal goals in joining Rotary. What is Rotary? We have a short video that we downloaded from the Rotary International website that explains the many goals of Rotary International.